Welcome to this explainer. Look, if you're a parent or a caregiver, you already know there is absolutely nothing quite as stressful as seeing your little one sick or in pain. Today, we're going to unpack the Mederi Pediatric Guide to Urgent and Preventative Care. My goal here is super simple: to empower you to make fast, confident, and accurate decisions when your infant or teenager needs medical attention. We're going to completely take the guesswork out of those high-stress moments.
Because it's the ultimate parent's dilemma, right? Your kid wakes up burning hot to the touch, or your toddler takes a tumble and completely scrapes up their knee. Your mind just instantly races. Do I wait this out? Should I call the doctor? Do we need to rush to the hospital right this second? And seriously, why does this always seem to happen at 2 a.m. on a holiday weekend? Well, today we're actively building a mental framework to conquer that exact panic. By the end of this explainer, you're going to have a clear, reliable playbook for exactly what to do. Okay, here is our quick triage roadmap for today. We'll cover common illnesses, handling injuries, identifying infections, the power of prevention, and finally making that crucial call between urgent care versus the ER. All right, let's jump straight into Section 1, Common Childhood Illnesses. So as we dive into the most frequent invaders, we really want to focus on distinguishing specific symptoms and tracking how long they last. That's how you know what's just normal and what actually requires a professional. Take the common cold versus the flu, for example. The contrast in speed and duration is wild. Colds are sneaky. They have a really gradual onset over a few days. You get that classic runny nose and a cough, and they typically take a bit longer to fully clear up, usually around 7 to 10 days. The flu, on the other hand, it hits suddenly, literally like a freight train, right? When you have your busiest week at work, it brings a high fever, severe body aches, and deep fatigue, but it actually often resolves a bit faster, in about 5 to 7 days. Your key trigger to seek care for either of these is if your child develops difficulty breathing, severe symptoms, or any signs of a secondary bacterial infection. Now here is the when to worry pivot for throat and ear pain. Strep throat is bacterial, which means it absolutely requires antibiotics. But how do you actually know it's strep? You want to look for the hard metrics: a fever spiking above 101 degrees, a sudden, really severe sore throat, and those telltale white spots on the tonsils. A quick swab at the clinic will confirm it for sure. Then you have ear infections, which, often pop up right after a cold. You'll see them tugging at their ear, maybe a fever or some drainage. But here's the rule of thumb. You can actually often wait and observe these unless the pain is severe, the fever is high, or those symptoms last for more than 24 hours. When we're looking at respiratory and stomach symptoms, a cough can actually tell you a whole lot. A dry cough might just be a lingering cold, while a wet cough with mucus suggests a respiratory infection. The absolutely crucial takeaway here, though, is watching for a barky, seal-like cough in toddlers, especially at night. That is a hallmark sign of croup. You need to seek care if a cough comes with a high fever, breathing difficulty, or just lingers beyond 2 weeks. As for the dreaded stomach flu, bringing the vomiting, diarrhea, and belly pain, the illness itself usually passes on its own in 24 to 48 hours. The real danger you're managing there is dehydration. If they absolutely cannot keep any fluids down, that's your cue to get medical help. Moving right along, let's hit Section 2, Handling Bumps and Bruises. Okay, we're shifting our mindset here. We're going from diagnosing internal symptoms to measuring physical, external red flags. I want you to apply these exact, objective, rule-of-thumb metrics to cuts and burns so you aren't second-guessing yourself in the heat of the moment. Step 1, measure it. If a cut is gaping or longer than 1/4 of an inch, or if a burn is larger than 1 inch across, you need a professional. Step 2, location really matters. Any significant cut or burn on the face, hands, or genitals requires an evaluation. Step 3, assess severity. If a cut is still bleeding after a full 10 minutes of firm, continuous pressure, or if a burn is blistering heavily or the skin looks white or charred, do not wait. Go get medical care immediately. Now, we all know kids fall basically all the time, but for falls and sprains, your immediate red flags are actually very specific. If your child hits their head, you are immediately on the lookout for neurological signs. If that bump is followed by drowsiness, confusion, vomiting, or seizures, that is a drop everything, immediate medical situation. For sprains and strains, the real test is functionality. If your child has a complete inability to put weight on a strained limb, if they simply cannot move it, or if you notice the swelling rapidly getting worse, you need to bring them in for an evaluation. Next up, Section 3, Identifying Infections. So these are specific bacterial and fungal invaders that require targeted prescription treatments to actually resolve. There are a few specific triggers you really should just commit to memory. For instance, Any suspected urinary tract infection, which usually presents as pain or burning during urination, frequent urination, sudden bedwetting, or belly pain, needs prompt antibiotic treatment. For the skin, please remember this golden rule. Any skin rash that is accompanied by a fever requires immediate evaluation, period. Other issues like fungal ringworm can be treated pretty easily with topical or oral meds. And for the eyes, pink eye brings that redness, discharge, and swelling. If it turns out to be bacterial conjunctivitis, you're going to need antibiotic eye drops to clear it right up.
Which brings us to Section 4, the power of prevention. Let's flip the script for a second. Instead of reacting to an illness, let's look at how we prevent these illnesses from taking hold in the first place. We're talking about building your child's medical shield. And the core of that prevention, vaccines. Vaccines are essentially medical tools that safely train a child's immune system to recognize and fight off serious diseases without the child ever having to actually suffer through the sickness itself. It's like a training camp for their cells. It's incredibly important to remember that before vaccines were available, diseases like measles, polio, and whooping cough were historically deadly, tragically killing thousands of children every single year. Let's see how this builds chronologically through your child's early years to create that protective shield. It kicks off right at birth with the hepatitis B vaccine. Then, between 2 to 6 months, we layer on massive protections with vaccines like DTaP, IPV, PCV13, rotavirus, and Hib. As they move into that 12 to 18-month window, they receive essential boosters plus the MMR vaccine. And as they finally reach school age, around 4 to 6 years old, it culminates in those final early boosters, annual influenza shots, and importantly, annual wellness physicals for developmental screening and nutrition management. And finally, Section 5, the crossroads, urgent care versus the ER. We have reached the climax of our explainer. This is the decisive matrix. When your child needs care right now, how do you choose exactly where to go? Urgent care or the emergency room? It's a tough call, but here's the breakdown. Use urgent care for things that need quick attention but aren't life-threatening. We're talking about a fever lasting more than 3 days, sharp ear pain, a severe sore throat, a persistent cough, a wound that clearly needs stitches, a suspected UTI, or a rash with a fever. But, and this is absolutely vital, you must bypass urgent care and rush directly to the ER for immediate life-threatening situations. That means any difficulty breathing or wheezing, severe swallowing issues, chest pain, any loss of consciousness or severe head injury, uncontrolled bleeding, suspected poisoning, seizures, or a severe allergic reaction. Now, if you do find yourself needing non-life-threatening care, Mederi Urgent Care is a truly fantastic option. They specialize in pediatric services from infants straight through to teenagers. And what's really great is they offer this comfortable, spa-like environment, which is a total game changer for calming down anxious kids. Plus, they're open 7 days a week from 9 a.m. to 9 p.m. And walk-ins are totally welcome. It's just great to have a reliable place like this in your back pocket. You can find their locations across the Los Angeles area, including Hollywood, West LA on Northwestern Avenue, and in Glendale on North Glendale Avenue. So we come all the way back to that moment of panic in the middle of the night, equipped with this structured framework of exact timings, temperature metrics, and clear triage rules. You don't have to guess anymore. You can transform that panic into calm, calculated preparedness. The facts are literally on your side. So I'll leave you with this thought. Instead of frantically asking, "What do I do?" the only question left to ask yourself is, are you ready to take charge during the next emergency?